Sounds like a good idea.
One way presidential candidate Donald Trump says he'd lower healthcare costs is to let people buy insurance from other states.
We should have gotten rid of the lines around each state so we could have more competition.
He's not the only Republican to support that idea. Ted Cruz recommends it too.
We should allow people to purchase health insurance across state lines.
In fact, it's a Republican idea that dates back more than a decade. But is it a good idea? Experts say probably not. In fact, 3 states already allow interstate sales of insurance: Georgia, Maine, and Wyoming. So does the Affordable Care Act if all the states involved agree to it. But so far, not a single insurance company has offered to sell a product in one state to people in another state. Why not? Because it turns out that selling one state's insurance plan in another state isn't so easy. For one thing, most insurance plans today have specific networks of doctors and hospitals. So if you're in Florida and you want to buy a plan from North Dakota, it's unlikely that North Dakota plan will have many healthcare options for you in the Sunshine State. Those who support the idea say that people would save money by buying insurance from states that require fewer benefits, particularly expensive benefits like coverage for autism or fertility treatments. But the difference in benefit levels between states has been narrowed because the Affordable Care Act created a more uniform set of benefits most plans have to include. Of course, all the Republican proposals assume the ACA will be repealed, and some still worry about what they call the race to the bottom. That would happen if insurers choose to locate in states with the most lax regulations so they could offer cheaper but also less comprehensive policies. That could draw the healthier people out of their home states, leaving behind sicker people and causing insurance premiums there to rise. That could put consumers on the hook if something happened. If you buy a policy from another state, who would you call? Your state's insurance regulator doesn't have any power over plans sold in other states. In short, selling insurance across state lines sounds like it would be a good idea, but it hasn't worked so far. You're in a hospital room. You're sick. Nurses check on you regularly and give you medicine. Your doctor has ordered treatments, but you have Medicare, so you figure you won't face a hefty bill. Well, surprise! You learn you haven't been admitted to the hospital. Instead, you are receiving observation care. That means doctors have decided you won't be staying more than 2 midnights. Your doctors and nurses are monitoring your condition and watching to see if you need to be admitted. But often, patients can't see any difference in care. Medicare considers observation care an outpatient service, even if you stay overnight at the hospital. So you will likely have more hospital costs than if you had been admitted. Costly, the co-insurance Medicare charges for outpatient care, usually 20%, and the bill for the drugs they give you for your heart conditions. So here's a comparison. That baby aspirin you take for your heart condition, it could cost $18 at the hospital, instead of the pennies you're used to paying when you buy it at the big box store. And because Medicare has no limit on out-of-pocket charges, all of that is. The price tag could be even higher if you go to a nursing home after leaving the hospital. Medicare will help pay for that expensive care only if you spend at least 3 consecutive days in the hospital as an admitted patient. Observation care doesn't count for that long. Nearly 1.9 million Medicare patients received observation care in 2014. That's a spike of 103% since 2006, while Medicare enrollment rose only 5% during the same time. Why? Because Medicare has been trying to make sure the federal government doesn't overpay for care. Complaints about observation care prompted Congress to pass the Notice Act. It does not change your financial responsibilities. It requires that hospitals tell you that you're in observation care after 24 hours, and what the cost might be. For more information about Medicare and observation care, check out the link
links on your screen.